Alright, so this morning I'll be talking about bones of the head and neck. That's the anatomy of the bones of the head and neck. So the first bone which I'll be looking at is what is known as a C1 atlas. Okay, C1 atlas. Okay, so the C1 atlases have to do with, it is kind of like the first cervical vertebrae. You get, so it's kind of like different from the rest. So there's a way we now try to like study it differently. The C1 is different from the rest. The C2 is also different from the rest. But the other ones are kind of like similar. So we can actually just group them together and discuss them later. So for the C1, what we got is this. We said that it's the first cervical vertebrae and is unique in how it actually looks and the work it does. So it supports the skull and it allows nodding movements. So location at the very top of the cervical spine, it is directly beneath the skull and above what the C2. So you have the C1 then followed by the C2. Okay, so what's the shape and type? It's an irregular vertebrae, it's ring shaped, and is specialized for articulation in the skull. Okay, so let's quickly look at this. So what are the key features? The key features is I think this image would be the best for the key features, right? So we have what the anterior arch. This is what the anterior arch. We have the posterior arch. So this is what the posterior arch. Anterior arch is at the front, posterior arch is at the back. Okay. We have the lateral masses, we have the superior articular facet, inferior articular facet. So let's look at them. This is a lateral mass, then superior articular facet. Let's look at this. Well, here they just said articular facet, right? But I know this one is in the front, this one is at the back. Do you understand? So that's the basis. Then we have the transverse process and sometimes spinous process, transverse process and spinous process. Let's look at this. So this is what the transverse process, and well, the spinous process is not written here, but just know that it exists, and probably you could look check your atlas to actually look at it, you know, but just put out the transverse process is there. Okay, then well, for C2 the spinous process is so prominent. Do you understand? So for C1 the spinous process is they said okay, there's no body and there's no spinous process. Please get that. Okay, get that. There's no spinous process for C1. No spinous process. All right, so articulation before it joins with the occipital bone. This is the back of the bone to the skull. Okay, so just going to the neck is one. So because they articulate there, it helps you to be able to nod. Yes. Okay, somebody asked you a question, anytime you said yes, you nod it with your head, just know that is a C1 that is doing the most of the work. Then beneath it, it fuses with the C2, but the fusion of the C1 and the C2 is kind of like permanent, so there's no motion there. So function is basically support the skull. It allows flexion and extension. It works with the axis to now enable rotation of the head. So clinical notes, it could be affected by lots of fractures, you know, which is known as a Jefferson fracture. We'll talk about it when we're talking about the clinical importance of the C1. So Jefferson fracture is like a burst fracture of the atlas. So they could also be damage to the what? Atlanto-occipital or atlanto-axial joints. Then it's very, very important in anything neurosurgeries and anything trauma care. Okay, because it is actually what's close to the brain stem and the spinal cord.